Hello, I'm Whitney Bishop and I'm the TMS coordinator here at Eastside TMS and Wellness Center in Renton, Washington. October is National Depression Awareness Month, and this month we want to bring you guys information on depression. What are some signs and symptoms that someone might experience when they're in a depressive episode, how TMS helps with depression, and how to get started with TMS therapy. When a patient first comes to our clinic for an evaluation with our provider, or when they're first starting their treatment, we like to discuss with them kind of how they started noticing their depression and how it has progressed to where it is when they first start their treatment. For each patient or person that might be experiencing depression, your signs and symptoms of it could vary. There's a list of different signs and symptoms of depression, and it doesn't mean you're going to experience all of those, or you might have one that maybe isn't on every list when you look it up, and so you might think, maybe I'm not having depression, maybe it's something else. So it's important to notice changes maybe in your behavior and how you're feeling about things, and to seek help or evaluations from a behavioral health professional if you think that there is a possibility that maybe you are suffering from depression. A lot of patients that come into the clinic, they notice first kind of small little changes in their behavior, or how they react to things, or how they're feeling. A lot of patients will have a general feeling of sadness, not necessarily from any one event, but they feel sad. And they also might notice that small little challenges in the day that they have kind of on the more extreme end of reactions to those. So maybe something small happens in their day and they feel like they're going to cry, and they realize that's kind of a lot for what's happening for this situation, but they can't help it. They might have feelings of hopelessness, or they might start to worry about things a lot, but not take the steps to deal with any issues that they're worrying about. A lot of times patients will notice that they have a hard time focusing on activities that they could do before. So let's say in their work day, before they could get all their tests done that they need to in the day, and then all of a sudden, even the smallest task, they can't stay focused on it. They can't complete it. It seems like it's a really big task, even though it's something small. And they might start putting work off, or putting off activities or things they need to do at home. A lot of people start to notice that they're no longer enjoying activities that they used to really enjoy. Could be things like if they normally like to play sports, or go to the gym, do different types of artwork, read books, social activities, those type of things. Let's say that was something that brought them a lot of joy, and it was something they did regularly, and they just loved doing those things. All of a sudden they start to notice their interest in those activities is declining. They don't find them enjoyable. They might start avoiding doing those activities. So you take a component of your life that previously was something that brought a lot of joy or reduced stress levels, and you kind of take that away. That can also cause, those types of feelings of sadness, hopelessness, things like that, and you're just not enjoying it. Another thing that a lot of people might experience is with social interactions, whether it be at work, with friends, with their family at home. Maybe they're finding those a little more difficult. Either someone can find it really draining trying to keep a conversation because they're having a hard time focusing on activities, so they tend to wander, or they're kind of, as they're talking to someone, they're thinking, I don't want to be doing this right now, I don't want to talk to you, but I will. They might find social activities to actually be very isolating and have a sense of loneliness. sometimes they might feel like I'm the only one that feels like this, and I'm looking at all these people in the room and everyone's smiling and laughing. Should I be putting on a happy face? Why do I feel so sad? And that can be a very, very lonely feeling to have in a room, especially if no one else around you or in your peer group knows that you are experiencing those symptoms. A lot of patients might start to feel really tired and drained, and not necessarily from the lack of sleep. It could be that they slept fine, but they're waking up feeling exhausted and thinking about what they need to do in their day just seems like a huge mountain to climb with the amount of energy and feelings that they have. Sometimes when you're experiencing depression, you might notice a disruption in your sleep pattern to where you're finding it really difficult to get a restful night's sleep as well. A lot of times patients might feel kind of this sense that they have to keep it to themselves and no one else understands what they're going through, and they're just kind of not enjoying their daily activities. And it can get to the point where just getting out of bed in the morning, it can seem like an impossible task for someone that's experiencing a major depressive episode. If you think that maybe a loved one or a friend might be experiencing depression, or if you yourself feel like you might be displaying signs of depression, please give our clinic a call at 425-919-6826, or you can visit our website at eastsidetmswellness.com. Don't forget to give this video a big thumbs up and share it if you find the information helpful. Thanks so much.